All right, we're here today for our general eye exam video. First, before we get anything going, we're going to start with a little history of the patient, kind of get some background information on their condition and what they might be presenting to us today. So first of all, I'm going to ask, do you normally have good vision?
Yes, I do.
Do you? Okay, good. Do you wear any corrective lenses or contacts or anything like that?
Mm-mm.
Okay, very nice. Have you ever encountered any previous injury or anything of that sort to the eye?
No, I haven't.
To either one of them?
No.
Okay, good. And are there any other conditions or past bacterial infections or any type of condition that we should know about that you've had to deal with?
Nah, pretty healthy.
Okay, good. So from there, that's kind of our general history of some conditions the patient might have. We'll move right into some inspection now. First, I want to notice if is there any swelling present in either eye?
Mm-mm.
No? Good today. Any discoloration you may have?
No.
Good. Is there a gross deformity or something obvious that's sticking out right now?
Mm-mm.
No? Good. Any lacerations on the eye or near the eye that you might have?
No.
Good. You said before no bacterial infections, but is there any like deviations in pupil shape or anything abnormal that you've kind of been able to see in the mirror or something that's concerning to you?
No, nothing like that.
Okay, really good. So now from here, from the inspection part, we're going to just move into just a few palpations on the face and near the eye area. So from here, I do want to kind of feel bilaterally the zygomatic bones. They're intact, good. The orbital region of the eye, that border is nice and firm. Nasal bone is firm and intact. Everything's all good there. Any numbness or tingling with any of this? Any pain that you might feel?
No, no pain.
This is all good.
Mm-hmm.
Okay, good. So now from here, our inspection and palpation is finished at this point. We're going to move right into a pupillary response test, which we're going to use a pen light for this. So for this, we do have our pen light. I'm going to have the patient cover one eye with his hand, and I'm going to shine and flash the light real quick in the pupil just to get see some of that dilation occur. So if you can choose one eye that you want to cover. Very good. I'll stand on this side. So I'm just going to turn this on, flash it real quick, just look straight ahead.
Okay.
Good. And there is normal dilation occurring in that pupil. I'm going to test the other eye as well, if you don't mind. So we'll cover that other eye. Come on this side. Can you focus okay?
Yeah.
Okay, good. Go ahead, look straight ahead. Again, normal constriction, dilation there. Everything's healthy in that regard. Okay, so now we're done with the pen light and the pupillary response. We're going to move right into some eye tracking for the patient. So for this, I'm just going to stand right in front of the patient, do a little finger tracking test, and they're going to follow my lead. Let me get on the good side. So from here, I'll squat down just a little bit so the camera can see. I'm just going to hold my finger right in front. You just move your eyes only. Don't worry about turning your head or anything like that. Just stay right nice and still. Just follow the finger, okay?
Mm-hmm.
Not moving too far out of the patient's line of vision. Normal tracking so far. Good. Healthy tracking right there. The pupils and eyes have no problem following that finger there. Now we're going to work on do our vision exam. So I'm going to have the patient actually stand up for me. I'll just have you come right back against this way. We have our eye chart measured out behind the camera here, 20 feet. We're going to have the patient cover one eye again. We're going to test both eyes in this regard. First, he can choose whatever eye he wants. Cover that eye. I'm having him read the letters off this eye chart here.
Go.
Okay, so just start at you don't have to start all the way at the top with that big E, but you can start maybe like midway down, decent sized letters. Read this third line for me.
So T-O-Z.
Good.
L-P-E-D.
Good.
PEGFD.
Okay, and one more.
EDFGEF.
Good. And then, okay, so now that was good for that one. That was the first test for that eye. Now we'll just switch this one, this next eye. You can go ahead and refocus a little bit. We'll cover up again, redo that test.
Okay.
So we'll start with that third line again.
TOZ
Good.
LPED
Fifth line.
PECRD.
And down. One more.
Whoa. DERCER.
Okay. So we had a few mistakes on that left eye. It's a little bit difficult to see that chart from here, and lighting may not be the best, but we do have a little bit of concern with that left eye just as far as clarity. But now, after this eye test, you can go ahead and have a seat actually, thank you. This last bit of the exam, we're going to use the ophthalmoscope, and we're just going to be checking for a few structures deep within the eye using the light. So here we have our ophthalmoscope. I'm going to shine the light again in the patient's eye. We're going to cover one eye again. I'm going to come right in and just examine right here. So from this angle, I can see that optic disc. A little bit deeper in there is a dark spot of the fovea. All looks healthy. I'm gonna switch sides. Do that other, yeah, refocus a little bit.
Okay.
Go ahead, look straight ahead. Same thing, optic disc here. Maybe a little bit of an angle, we can see that dark spot of the fovea. That will conclude that test. And that wraps up the portion of our eye exam right there for the general patient. Thank you.